So the plan B would be a more effective medication, and it wouldn't be pills anymore. Well, that's not entirely true. It could be one set of pills called Mavenclad. I'll talk about that a little bit. It can be Ocrevus, which is a twice-a-year infusion, or it could be something like Kesimpta, which is a monthly injection, or Tysabri, which is a monthly infusion. Lots of different options. The reason I would do it is because I'm trying to keep you working, high functioning, and if the Vumerity is just not cutting it, then I at least will have a plan in place for the next couple of months.
Okay.
Okay, so these are your scans. No, so if you go to, you'll have to pull down the little, where it says 10 up there, yeah. It should say axial flare. You just pull it over. Okay, so that is about, so when you're looking at an MRI, that's your right side and then this is your left side because you're lying flat on the scanner, right? You're looking up towards your feet.
Right.
That's like this.
Exactly. Okay, so that arrow that's pointing, that's a new lesion that popped up about 6 months ago.
Okay.
It's on the right side of the brain, and then there's another one that's a little bit higher on the left side.
So start from the top.
Okay.
So these are, some of these are some that were there before.
Mm-hmm.
They haven't changed. That one's a new one.
Go back up to the top. There's an arrow. You just have to wait for it. There. There you go. That's the other new one. So one is on the left, right at the top of the brain. The other one's a little bit lower on the right side. We don't want to see new lesions, okay? Now, let's go down. And very typical appearance of multiple sclerosis, okay? And all the white changes that you see are scarring from the MS. And we're trying to put the brakes on it, okay? So you do have a lot of disease, and we have to be really vigilant, meaning really active in if your medicine is working or not.
Yeah.
So let's say your scan comes back, doesn't look much better, it's more active.
Okay.
Then we have some categories of medicines to consider.
Yeah.
One of them is Mavenclad. That's a medication that you take, it's a pill, and you take a week's worth in month 1, and then in month 2 you take another week's worth, and then nothing for a year. Okay, what it does is it drops your white blood cells down, not to dangerous levels, but it drops them down and tries to reset the switch so that your white blood cells don't cause damage in the brain and spinal cord. Okay? We have to monitor you and do more MRIs and all that, but it's kind of essentially how that works. Kesimpta and Ocrevus are our B as in boys, cell-depleting drugs. And those basically come in and kind of pop some of your white blood cells to reduce them. And the theory is that they basically will lower inflammation by reducing those cells, okay? And those are also very good medications, okay? The other one is Tysabri, which is a once-a-month infusion. And I will tell you, some of the way that we go with this depends on what your labs look like. We check things for HIV, JC virus, and hepatitis, and some of it will be dictated by, for example, if you have JC virus positive, we would kick out one medicine and consider the others. So in our list, make sure we put Mavenclad, Kesimpta, Ocrevus, or Tysabri. Okay, because we need to have at least an idea, like, for the next person that sees them. The labs will help us figure out where we need to go, okay? I'm just trying to decide if we need to do the labs today. Has he had the quantiferon, the hepatitis B, hepatitis C, JC virus? What was that? It's positive, huh? 4.3?
Yeah, detected.
Okay, so JC virus is a virus that pretty much 80% of people have.
Oh.
We don't have any symptoms of it because our immune systems are intact, but it was first described in the HIV/AIDS population because those patients aren't able to fight off infections, and so it kind of blossomed in them, meaning it grew. Because you're JC virus positive, I would not put you onto Sabri. So it's either going to be Mavenclad, the pills, or the B cell depleting drugs, Ocrevus or Kesimpta. That's where I would go with you. Okay, so we've narrowed it down even more.
Okay.
Okay, because there's no way his JC virus is going to go back to 0. Once it's positive, it stays positive. But what we should do, I think we should probably go ahead and draw them today. Are you okay with getting blood work done today?
That's fine, yeah.
Okay, so which
Yeah, CBC with div, CMP. Immunoglobulins. Immunoglobulins, serum. It should just be, if you type out immunoglobulins, it should come up. Or not. How about IgG and, yeah, IgG and IgM?
just both of them?
Uh-huh. So that's what we use, we look at those when we're giving people B cell depleting drugs, right? He needs a quantiferon, HIV, the screen, Hep C, and then the hepatitis B. It's, yep, surface antigen, core antibody.
That, I guess it's all of them.
Yeah, well, you have to order, I think you have to order them individually.
Great.
Yeah. And then you have to click on database. See at the top it says facility list. Here it is. Core antibody, surface antibody, and surface antigen. All those top 3. Okay.
Antibody, surface antigen, surface antibody.
Yeah, the 3 Hep B. Okay, again, this will help us decide where we're gonna go with you, okay?
Okay.
And then one more thing, it's on a VZV. And I know we're just tossing out letters. I can appreciate that. There's a purpose, okay. How about your job? How long have you worked there?
Both I've been working security about 3 weeks.
Okay,
Linked up a little over a month.
okay. And how's it going? Are you having any problems like with regards to your MS completing your jobs?
No, it's
Wonderful.
fine. Just maybe the short-term memory.
Okay.
It's kind of told, but not fully, not heavily.
Okay. All right, like give me an example.
Let's say more at home. Mom's telling me to do something. I forget. It was important, but she understands what's happening with me. At work, they instructed me at security job how to create a badge for employees and visitors, and it's just a lot to take in memory-wise,
Yeah.
and contractor badges also.
Mm-hmm.
How to create them. Contractor badges, similar to how to make the badges for employees. I know how to make temporary badges for employees. That's fine. We just have to inactivate their badge that they lost, let's say, and give them a temporary badge. And if they have left it at home, it's just for a day. We'll do 2 days because I'm overnight. I got to put 2 days. And
So I would say the best, it's a very common complaint we hear in our MS patients about short-term memory,
right.
difficulty kind of learning new tasks.
Yeah.
So if you want, I think a better way to do it, and you don't have to tell anybody you have MS, by the way.
Okay. Yeah.
But you just tell them, hey, you know what? I would learn the best if you wrote it down.
Okay.
Could you write it down, like the set of instructions, or let me go slow enough so that I can write it down?
Yeah.
But it needs to be written, even if there are tasks to do, like let's say at home, make sure your family or whomever writes it down. That
Yeah.
and like with a checkbox, that way you have a visual reminder.
Mom did that yesterday. She bought a basketball hoop for my yard,